everyone for coming on such short notice. I am here today with my Chief of Staff, Danielle Letourneau, our Healthcare Liaison, Jennifer Hoffman, our Fire Chief, Chief Strand, and Police Chief Hay. I know that many people here have heard about some cases inside of healthcare facilities in our city of Greenfield. We are aware of these cases in the community, which is why we're here. Following the guidelines of the State Commissioner of Public Health during this time of escalating health emergency, our emergency management folks, Jennifer, the two chiefs, and a number of people involved in the city, Jennifer's with the health department as well, are maintaining awareness of presumed and suspected cases in the community and maintaining the confidentiality of this information to protect people's privacy. However, we do want you to know that we are in constant communication with all local healthcare facilities, including nursing homes, and we are appropriately briefed on confirmed or presumptive cases via Jennifer Hoffman, our liaison, and our public safety and health department professionals here in Greenfield are following the advice of the Massachusetts Department of Public Health and the CDC, and are asking community members to do the same. That means, and it sounds like a broken record, it sounds too simple, but those guidelines are to stay at home as much as you possibly can, social distance yourself, maintain that 6 foot distance. Is everybody doing that? Seem to be doing it pretty well. Good, including you guys. So thank you for that. But every time I ask a healthcare professional or an emergency management person, what can I tell people now to do? They keep saying that because that really is what you should be doing. So do that. Wash your hands, clean surfaces. If you feel ill, contact your PCP for medical advice. The other news today is that our public safety and health department professionals here in Greenfield formed a COVID-19 Emergency Operations Center here at the John Zahn Community Center to serve as a centralized informational hub, a clearinghouse of information to help us respond to the pandemic. Out of this location, which we will call EOC, our emergency management personnel will be focused on sustaining all communication and requests to local, state, and federal pandemic responders, coordinating the needs for supplies and resources, collaborating with neighboring communities, and stay connected to a statewide network tracking the virus and the state's response to it. I do want to be very clear about this, however, that this location, the EOC, is not open to the public, since we cannot accommodate drop-in visits of people with virus concerns or who just want to know how things are going. However, early next week, we will have a COVID-19 information hotline that's operational, answered by volunteers and city staff who are being supported by our health department. The focus of our hotline is to answer all questions that individuals and agencies may have specific to COVID-19 and what services they may need. We have already been fielding many of these questions and concerns at City Hall, at the Health Department, and in other departments. And now we will be able to have one number for citizens to call. If you feel like you are experiencing any serious or life-threatening symptoms, call 911, of course. We will have all of the information I outlined today available on our Greenfield, Mass website. I would like to say that we have, for the members of the press who are here, we have just today brought on a communications coordinator, and he's also here, Keith Barnacle, over there in the tan slacks and gray jacket. And you may be hearing from him from time to time. He may respond to your calls first before I have a chance to speak to you. So just know that that's who you'll be hearing from often. Relieving Danny of some of that responsibility for the time being, so that, and this is a temporary position for Mr. Barnacle, so that she can continue to support our wonderful staff in the City of Greenfield. And I just do want everyone to know you are in good hands. We have wonderful people running our departments. Thank you.
Take some questions.
One or two.
Could you confirm that there are cases in nursing facilities in Greenfield?
I think we can, yes.
Can you say which one?
I think
Sorry, can you repeat the question?
she wanted to know if I could confirm whether there are any confirmed cases that that came from nursing home facilities.
Confirm that there's a nursing home, that they are nursing homes, but not which one.
Yeah.
At this point, things are changing so quickly that even if we were to do that, things could be incorrect an hour from now. So
Yeah. I think that's actually really safe to say, because it changes minute by minute.
Any thoughts, Mayor, on the idea of a shelter-in-place order at this point for Greenfield?
No, there are not any thoughts on that. I mean, I've been thinking about it, but I'm not thinking I'm going to do it. And I probably wouldn't do it unless I was ordered to by the governor.
Do you have any concerns that people aren't necessarily taking social distancing guidelines seriously?
Well, of course. I wish that people would. I wish that from time to time I would remember to do that. But it's difficult. We human beings are very sociable animals, and except for those of us that don't want to be, and they're already taking care of themselves. But so it's difficult. It really is. And I just encourage people to keep that in mind, particularly if you're out at the grocery store or places like that.
What types of services or operations will be operated out of here at the John Zahn Center in this new operations facility?
Well, that'd be a good question for Chief Strand, because he's the man.
Hi, good afternoon. My name is Bob Strand, S-T-R-A-H-A-N. I am the city's fire chief and emergency management director. We will be operating an operations center here at the John Zahn Center. Really, as the mayor stated, as a clearinghouse of information. We will be coordinating resources that are needed to respond to this emergency, either from a health standpoint or a public safety standpoint. Our goals are to get out as much information that is consistent and accurate, and so every piece of information that will come through the center will be verified, and we will try to coordinate that information. It's really a center that's going to coordinate the overall response of this emergency. We are in a state of emergency, not only at the local level, but at the state and federal level. And so the resources from public safety, the health department, and the city as a whole will be working together to coordinate the response for not only the response to this emergency, but for the recovery afterwards.
Bob, what kinds of preparations have you made for first responders or department people, and under what situation should people call you for help?
So obviously, an emergency should be handled as normal. So if there's a fire or there is a medical emergency, you still call the 911 system. We have taken active steps to put in scripts for people that have medical emergencies when they call 911 to try to help our responders with information before we get on site. I know the public safety agencies are looking at their response models and working closely together with the local ambulance provider as well as police and fire to make sure that we are responding appropriately. All our first responders are taking necessary precautions in regards to proper protective equipment. Although our supplies are running low, we have supplies to get us through, and we are working on coordinating with the state and federal governments to make sure that our responders are protected. We are monitoring them daily. We have isolated the facilities at the police and fire station to really try to keep our first responders as protected as we can. But it's business as normal for our responders. They will respond to the emergencies. We have contingency plans if we have responders that have been exposed, and we are developing more plans as we go forward.
I do want to say that our elected officials at the state and federal level, I'm talking now about Representative Paul Mark, Senator Joe Comerford, and Senator Elizabeth Warren, have been in contact with me, and not just me, but all of the mayors of Massachusetts. And I am grateful for all of their help, particularly at the local level. I think Senator Comerford and Representative Mark are doing everything they can, every opportunity they can to push for resources for us out here. The reason I was late was I just got off of a phone call with them. So, and Senator Markey's office as well. So, thank you very much. And with that, why doesn't everybody go social distance themselves for the weekend?